Hi, it's Kat at Orion Billing. I'm making a series which is medical billing for beginners, and this is part 1. It's going to go over what medical billing is and give you a initial review of what the tasks of a medical biller are. Medical billing is, in brief, the process of making sure that healthcare providers get paid for all their services. They receive payment from the insurance companies and from patients who need to cover charges the insurance doesn't pay or that go towards their deductible. A good medical billing specialist knows how to help providers get paid for the services that they provide in a timely manner and reduces the chances of claims being rejected or denied. What a billing specialist does can't easily be done by a computer because they do things like reading and understanding doctor's notes and records, checking and fixing patient and insurance information, and making sure that the right codes are used. The job is to gather all of that information, make sure it's correct, and put it together to create a claim. That's the first step. Then the claim has to be sent to the insurance company and go through the process of insurance payer adjudication. This is when the insurance company decides how much to pay the provider based on the information in the claim and the provider's contract and the benefits allowed by the patient's insurance. And after a claim has been adjudicated and responded to by the insurance company, then the payments need to be entered into the software and applied correctly. That part can be partially but not fully automated because there is thought and knowledge involved in accurately entering the information. And during the process of reviewing and applying the insurance responses to the claims, the billing specialist is going to learn a lot and need to handle that information accordingly. The billing specialist needs to be able to think with and figure out where any errors may have occurred. They may need to submit more documentation to make sure claims get processed successfully. Most of what a billing specialist does involves dealing with health insurance, and health insurance can be very complicated and it is always changing. So in a smaller doctor's office with only one doctor or maybe a few doctors, the billing specialist often handles everything involved in getting the provider paid. Parts of these tasks may be taken care of in the office by the front desk if there's a remote biller, or maybe the office manager of a practice, but they work together as a team to get the tasks done and ensure claim payment. Medical billing and medical coding are not the same thing, but they are related. A medical coder uses medical records to determine what the appropriate codes are for the medical services that were performed. Smaller practices, there is not normally a biller and a coder. And within a field of specialty, they often use the same codes over and over again. So there isn't really the need for a separate coder. Often the doctor also will do their own coding, or it's automated in their software, which simplifies that part of the process. So the biller then uses medical records to get services paid. And once the coding is done, it is the medical biller's job to use that information to prepare and submit a claim to the insurance company. Again, that is commonly automated within the practice software, but a biller should always review the coding and claims prior to submission to ensure that they're correct and send it back for coding corrections or to query the coding if it doesn't look correct. So it is important for a biller to have some coding knowledge and be able to look up the procedure codes and diagnosis codes when they need to. Medical billing tasks are the typical tasks of a medical billing specialist. Often, as I said, there is a team working together on different parts of these tasks. Everyone from the front desk to the medical biller and any other staff may touch on pieces of the puzzle to getting the insurance claims and patient bills paid. So it's important that everyone understands and does their part. I'll go over a lot more detail and additional tasks in part 2. So that's part 1 of this series on medical billing for beginners. I'm happy to answer any questions. Check us out on orionbilling.com. Have a great day.